Each day brings a fresh opportunity for you to set the standard of how dedicated and committed you are to your passion. Good evening, everyone. With great joy and immense exultation, I extend my warm welcome to all the dignitaries, guests, and delegates present here for Dr. Sudhir Raj and Memorial Webinar Series organized by DIKSHA E-Learning in association with Ayurveda College, Coimbatore. In today's session, we will be discussing about Garbhashaya mukhagata vrana and its Sthanika chikitsa by Dr. Sipika Swati. Before starting the session, I would like to go through a few of the basic instructions to be followed throughout these sessions. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbances-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any question can be raised in the chat box. Questions raised will be cleared at the end of the session. Now, I'd like to invite Dr. Vandana Ma'am, Assistant Professor, Department of Prasuti Tantra and Stree Roga, Ayurveda College, Coimbatore, to deliver the welcome address.
Thank you, Vidya. Good evening, one and all. On behalf of Ayurveda College, Coimbatore, and DIKSHA E-Learning, it gives me immense pleasure to extend a very warm welcome to our guest speaker and all the delegates present today. As you all know, we have our elegant speaker, Dr. Sipika Swati MS, to talk on Garbhashaya mukhagata vrana, cervical erosion, and its Sthanika chikitsa. I extend a warm word of welcome to you, madam, for accepting our invitation and for being with us here today. Once again, we welcome you all for today's session. Thank you.
Thank you, ma'am. Before starting the session, it's a great pleasure for me to introduce our guest speaker. Dr. Sipika Swati is currently working as Associate Professor, Prasuti Tantra and Stree Roga, IPGT and RA, Jamnagar, Gujarat. She has completed her UG and PG from BHU Varanasi. She passed her MD out in 2015. She has won 6 gold medals in her academic career. She has a teaching experience of 6 years and 9 years of clinical experience. She published 30 articles in national and international journals. She has also presented 20 papers and various seminars. We are very proud to have you here on this session today, ma'am. Now, without any further ado, we will turn the time over to respected Dr. Sipika Swati to enlighten our minds with her knowledge. Over to you, ma'am.
Hello, doctor.
Ma'am?
Is my video is visible or slides are visible?
Ma'am, the slides are visible, but it's not in the slide share mode.
Okay. But I have done from here in slide share. Now it's fine.
Sorry, ma'am, it's not in slide share mode.
Okay, I will do it again. I will share it again. Okay, fine.
Okay, ma'am.
Now it's fine, doctor.
Yeah, ma'am, now it's good.
It's in slide share mode now.
Yes, ma'am, the slides are normal.
Oh, okay, shall I start?
Yeah, ma'am, we can start your session.
Very good evening to all of you. First of all, I would like to thank our organizers, Ayurveda College, Coimbatore, and DIKSHA Academy, giving me this opportunity to talk on this platform on this current topic, Garbhashaya mukhagata vrana, cervical erosion, and Sthanika chikitsa. I am also thankful to our coordinator, AS. Sorry, I don't know your full name. And I am also thankful to Dr. Akhil for approaching me for this title and giving me opportunity on this platform. Second time I moved ably. First of all, my first lecture was in previous year upon Ashwin. So without wasting time, I will start the topic. As we all know that cervical erosion now is the commonest problem seen in women that which is causing her distress in her day-to-day routine, while either it's general health or many a times it affects her mental health also when it's in chronic state. And nowadays, most of our patients come to us with cervical erosion and having infertility also. We know that it is a condition where the sperm epithelium of exocervix is replaced by columnar epithelium of endocervix. And we know that columnar epithelium is more susceptible and vulnerable to any of infection or any type of trauma than squamous epithelium. So the cervical erosion is many timelines in superinfection causing cervicitis, acute cervicitis, sometimes patient may present with case of chronic cervicitis also. And if left unexplained and if left untreated, sometimes it may turn to precancerfication onto like one and chronic state of cervical cancer also. We know that prevalence of cervical erosion ranges from 17 to 50%, and in India, women of India, 80 to 85% of patients come to us with cervical erosion. In our APD, if 10 patients is out of 10 patients of vaginal discharge, 5 to 6 patients have any type of cervical erosion, either flat or papillary or follicular. We will discuss this type in the next slide. Why cervical erosion is important? Why we have to just give undue weightage to this case? Sometimes if you are not doing PS and PV of your patient, if you are simply advising treatment for abnormal discharge, what if patient comes to you and telling you that I have backache and abnormal discharge, or I have dyspareunia. So if you are not examining the patient, since you are writing the medication, sometimes you are just doing some injustice to the patient. Because in some cases, this cervical erosion, it is a warning sign of cervical cancer. So it is our duty to just screen the patient, do her pap smear and rule out that either it is normal cervical erosion or it is going to lead to mild to moderate or even cervical cancer in future. So don't let it go any patient of cervical erosion without examination and without diagnosis or diagnosis. Study published showed that among the patients who had unhealthy cervix, that is hypertrophic cervicitis erosion, or either bleeding on touch or suspicious lesion on cervix, has 45% has normal pap, while 17.4% patients has mild dysplasia and 9.8% has been 2 or grade 3 or 2. ICMR states that cancer of the cervix is the third most commonest cancer, with estimated about 1.05 lakh new cases in 2022. So we should just make sure in our mind that we should just treat each and every patient very cautiously. Now comes to the modern disease. What cervical erosion is? It is also known as cervical ectopy. As I have told that that our external cervical lip, that cervical lip, external loss, it is covered by squamous epithelium, and the endocervix is covered by columnar epithelium. But at a time, due to some cause like as I can say that due to high estrogenic state, the endocervix columnar epithelium is just encroached outward to the squamous epithelium of exocervix and cover the squamous epithelium. And when we do first speculum examination, the bright red area surrounding.
Excuse me, ma'am.
Yes,
Sorry
doctor.
to interrupt. Ma'am, the voice is breaking. Could you please check it?
Okay, my voice breaking.
Yes, ma'am.
Now it's fine.
Yeah, ma'am. Now it's good.
Now it's fine, Dr. Vidya.
Yes, ma'am. Now it's fine.
So when we do per spectrum pH examination of patients, we just find the bright red area surrounding extending beyond the external or in the exocervix, and the outer area will be clearly demarcated. Listen, it may be either smooth or with papillary folds. And I have already told that cervical erosion depends on sex hormones, especially estrogen. So it can be divided into two types, either congenital or acquired. Why congenital? Because female babies are born with some amount of hormone, maternal estrogen hormone in their blood. And under the influence of the maternal hormone, this hormone causes this spermocolumnar junction shift to the exocervix, and cervical ectopy, congenital cervical ectopy may be found. But we don't have to do anything in that case, because when the maternal estrogen will wash out from the female baby blood, it will heal and it will be cured not physiologically, normally. And in acquired cases, like it is very common in pregnancy, because we know that in pregnancy estrogen level is raised, and in OCT user, they are very prone to cervical erosion. And sometimes not infection is primary cause of cervical erosion, but in cervical erosion, as I have told, that columnar epithelium is more vulnerable to any type of infection. When any superadded infection occur in the cervical erosion patient, then will appear or present like acute cervicitis with backache, pulse may come to you. And if we just see the pathogenesis, I have told that there is shifting of trauma in columnar epithelium. And here comes the type of erosion. This, why I am discussing this type, because this is very important while we are treating the patient of cervical. We have to look the erosion and just categorize the erosion. Either it is flat type, either it is follicular or papillary type. Because our line of treatment we have to prefer, it depends on the type of the cervical erosion. Not it's that in every patient you have to do any parasurgical mixture, many of you can do it with simple uni tissue or uni or tumor. Because if the squamous epithelium, columnar epithelium is arranged in single layer, it is flat type cervical erosion. And if there is type of hyperplasia, so there will be inward fold to be accommodated that increased area. So it will look like a follicular appearance. And if hyperplasia is severe, then the fold will be inwards and outwards also, and it will give a papillary appearance to the erosion. You can see in this picture also. So single layer or flat type is simple, follicular type is medium type, papillary there is very much outgrowth like in the area, cervical eroded area. By examining the patient, by simply the PS, you can just categorize and you can just diagnose this flat type erosion, follicular and papillary type erosion by just vigorously examining the patient only by doing PS. What are the symptoms? We know there will be vaginal discharge. Discharge may be either mucoid, mucopurulent, or this is also discharge in cases of superadded infection. Sometimes it may be blood stained also due to especially prior to menstruation, due to premenstrual condition. And there is contact bleeding also, especially during in cases of pregnancy, if patient is in contact with her husband or in period. And if associated with cervicitis, present as backache, pelvic pain, and many times with infertility. I am since I just look on this definition that significant malignant transformation and abnormal growth stage of squamous vein. Vein is squamous vein, which is replaced by the columnar cell. And there are 3 grades in 1, 2, and 3: mild, moderate, and severe dysplasia. And severe dysplasia is categorized in carcinoma. We will not go in depth because we will just focus on simple cervical erosion, and SIM1 mild dysplasia comes in this category because it's another vast, it cannot be covered. And yes, I I must focus on this pap smear. I told that you have to, if the cervix is hypertrophy, there is chronic cervicitis, and there is more broad aerodactyl. So you have to just sure you have to do smear to rule out the cervix. So we all do pap smear in our day-to-day procedure bias, spatula, and cervical induction. You can see the process. I just want to highlight this. That's why I have just put it on a few slides. We all know how to take the pap smear from vaginal and cervical and endocervical smear. We just fix and just so before treating any type of cervical erosion, and especially if it is of papillary type and cervix is hypertrophied and there is recurrent lapse of cervical, please do pap smear, screen the patient, and then plan your treatment accordingly. Coming to the Ayurveda review, what is Garbhashaya muscle? I just write down some reference like Unimukh refers to Garbhashaya mukha, Antarmukhi Univyapar. We have just put it, Tara has put it as Prasvya Man, Suchimukh Univyapar. In our text, cervical erosion, it has not been quoted by any of us as separate entity. And but
Excuse me, ma'am. Sorry to interrupt. Ma'am, could you please remove your headset and check? Your voice is breaking, ma'am.
Dr. Vidya?
Yes, ma'am. Ma'am,
Voice
your
is
voice
not
is
coming?
not clear. Ma'am, your voice is
What
not clear. Could you please remove your headset and check it?
Okay. Dr. Vidya, now it's okay?
Yeah, ma'am, now it's fine.
I will just hello?
Yes, ma'am.
I will just disconnect the Bluetooth wire.
Okay, ma'am.
No, it's fine.
Yeah, ma'am, now it's fine.
Okay, okay. My slides are showing? No.
Ma'am, your slides are not showing now.
Okay, I will share again.
Okay, ma'am.
No, it's fine, Dr. Vidya.
Yes, ma'am, now it's fine. Ma'am, could you please share it in slide share mode?
Yes, yes, I will.
Okay, ma'am.
Okay.
Now it's perfect, ma'am.
So I was telling that we can correlate this cervical erosion with vrana. As we all know that vrana is derived from the root word vrin, which means to envelop, to just eat, the phenomenon causing destruction, discontinuation, or discoloration of the tissue of the particular part of the body. And the Garbhashaya one, there is no direct reference, but indirect reference something available in the context of Univariction Yantra, where Acharya has quoted Univran Darshan Yantra, where Yantra has been described of Darshan of Univrana. So they have quoted the term Univrana and in Unishata, like the Prajanan Vrana, in context of Shukshadya Vrana. They have Acharya Shushut have quoted this term. Coming to the Nidana, looking to the simple Nidana, Samanya Nidana of Vrana, there will be two types of Nidana, Nija and Agantuj. Nija will be Vata Pitta Kapha, and Agantuj, we all know that Visha,
Excuse me, ma'am.
Yes, Dr. Vidya.
Sorry again. Ma'am, the screen is not visible in slide share mode.
Okay.
Could you please share it?
Yes. Share it. Share it again. It's fine. Slide share
Yeah,
mode?
ma'am. Now it's good, ma'am.
Okay. Okay. So not moving. Slides are not moving. Slide share mode. Okay. Slide share mode. Hmm. Yes. Okay. Slide share mode.
Ma'am, any issues?
Yes, I will share again, Dr. Vidya. There is some problem. Slides are not
Okay, ma'am.
moving in slide share mode. I will
Okay,
share it
ma'am.
again.
Take your time.
That's fine. Slide share mode.
Ma'am,
Dr.
it's
Vidya, is
not
it
in
in slide share
slideshare
mode?
mode. No, ma'am, it's not in slideshare mode.
It's fine.
Yes, ma'am, now it's fine.
But in slide share mode, it's not moving. Slides are not moving. There is some problem. Dr. Vidya, is it fine? Slide share mode?
Ma'am, the slides are visible, but it is not in slideshare mode, ma'am.
Dr.
You
Vidya,
can
shall
see
we
an
continue
icon.
like this?
Yeah, ma'am, sure, ma'am, you can
Because there
continue.
is some problem. When I am
Okay,
doing
ma'am.
slide share, slides are not moving.
Okay, ma'am, it's okay, ma'am. You can continue your session.
Okay. So I was discussing about the Nidana, Nijana, Agantuja Nidana. And Acharya has told some Samanya Uniroga Nidana. We can just consider the Erosion Nidan from this Uniroga Nidana also, like Mithya Ashar, Mithya Ahar Vihara, Pradushchar. So we can consider the hormonal effect of estrogen under this heading, and Bija Dusti in congenital cervical erosion, what I have just discussed. In Mithya we are unwholesome and compatible diet, food items, faulty dietary habits, you all know, which all leads to Agniman, and it will further lead to just cervical erosion. And in Mithya excessive coitus at an early age, coitus in abnormal posture, and uses of contraceptive measures, it may produce local irritation and ulceration, which may also lead to infection and just cervical endodermal blood. And Pradustata, the Lakshmi explained in Astata, those are not applicable for the character of menstrual blood, but sometimes like Kapaj Pitta, Puna Granthi, and Goya VTC type of.
Excuse me, ma'am.
Yes, Dr. Vidya.
Ma'am, the screen is still on the first slide.
My slides are moving, Dr. Vidya. Okay, okay. But just do me share. Is it fine, Dr. Vidya? Now it's fine.
Yeah, ma'am. Now it's okay, ma'am.
Is it in slideshare mode? It's fine.
Yes, ma'am. It's in slide share
Okay,
mode.
fine.
Okay.
So it will remain like this till the end. Okay. Just skip. I will come to the samprapti. We all know our audience. We all know the just samanya vidan of Yoni Vyapada. Vidya Ahara, Vidya Vihara, Bija Dushti, and Atha Dushti, Acharya Charak has quoted. So cervical erosion nidan also falls under these four categories. And coming to the samprapti, the samanya nidan run K2, it will goes to dosh prakopa, Agimande, and Agimand leads to this samadosha sanchaya in the body of the patient. And at Bhatu level, it will cause Rasadosti, Raktadosti, and Arthodosti. And due to samadosha sanchaya, there will be dosh prakop, and Vishesh nidan, it will just hamper the local site, and due to agantuj, like Krishnathi, Apdrabhi Prayog, or Hitu of Gardini Unidabha, we all know that if patient during if liver pain is not sufficient and patient is just pushing, and then it causes the Gardini Unidabha. Some Acharya has correlated this Gardini Unidabha with cervical erosion. So this all leads to Garbhashaya to the blood. In coming to the dosha sharmoshna, all the three dosha are responsible for causing this Garbhashaya to the that Vatbai Chal and Shukshmagun, it will lead to abnormal cell division. Kappa by snake and picture bone, it will lead to excessive clay and pandu. And with the whites, it will lead to swelling of mans, dash, and the will be there. And it all lead to Dvakmansha, the Pati, Garbhashaya, and leading to Garbhashaya. We all know that some Praptigata that it will be the Erosion, will be the smart and Artha. There will be Bhatavani Manda, Shota, Shurashva, Raktava, Macho, and Artava. व्यक्ति स्थान will be Garbhashaya. Coming to our main portion, what is the motto of this lecture? Treatment. What are the treatment options and how we can approach to any patient of cervical erosion and how we can categorize? Because we all know that there are many local therapies, there are many Sani chikitsa we are doing gynecological patients and diseases, and we are achieving great success with Sani chikitsa in many chronic gynecological diseases. But in which patient we will just decide which Sani chikitsa you have to do. It was the main aim of this my lecture. I just wanted to share with you people. In local chikitsa, we are doing the Yoni Prakshalan, Erosion, Kalpadaran, Ishudaran, Yoni Varti. In parasurgical procedure, it comes the Agnikarm and Shardan, and internal medication, we are giving Shod and Ropan, which are Shrav, Hark, and Dogni, and Rakta Prashadan. Coming to our first Yoni Prakshalan. Yoni Prakshalan, we all know how to do Yoni Prakshalan. Like drugs, what drugs we are preparing here, like Panchvartal Kuvat, Tripla Kuvat. Sometimes we add Sukutantan and Spatik in Panchvartal Kuvat and Tripla Kuvat for Yoni Prakshalan. Duration for 5 to 10 minutes we are doing, and we are doing just after cessation of menses for 8 to 10 days. Method, we know that all investigation should be done. We just position the patient in lithotomy position. Obviously, you have to take the consent. You have to ask the patient to wear clean clothes, and you have to just follow the strict aseptic measure. You don't have to give any superadded infection or nosocomial infection to the patient. So you have to just follow the proper aseptic measure. We are doing here uniprexalan with nozzle and sterile rubber catheter with the help of enema pod. After Unileon, we just clean the external genitalia and we ask the patient to avoid spicy food, coitus, and constipation. Especially coitus in the treatment of cervical erosion is you have to ask your patient to avoid coitus while doing cervical erosion treatment and to avoid the spicy food. Constipation should be also looked after during the treatment of cervical erosion. What will be the effect, local effect of uniprexalan? Like we are using panchvatarkva, we are using tripla. So these all drugs are giving flavor and astringent property. It diminishes the strava, and with the thinning antimicrobial property, it will cut down the growth of microorganism at that local site. And with conducer property, because we are adding sometimes haridra also, like tripla yogurt with nimba, haridra, and spatik. If shrav is there and thin shrav is there, we are adding shuddha spatika. But if shrav is thick, infective, then in spite of spatika, you don't have to do stambhan there. We just add shuddha tankan because tankan has cup niskarak property, and we just want to remove that dusht cup from there. So there you should prefer tripla yogurt when there is infective discharge and thick discharge. If discharge is thin and watery discharge, then we prefer panchvalkalpua because our main aim to do stambhan there. Panchvalkan is spatika. And in infective discharge, tripla yogurt along with nimharitra and shuddhatankan you can prefer. And this uniprexalan, it has also ropan, sandhankar, and rasayan and antioxidant property. It rejuvenates the vaginal epithelium and helps in healing of the cervical erosion. Then comes the unipichu. We all know how to make the unipichu. Skip this slide. Here we are just giving unipichu after doing uniprexalan. We are inserting unipichu with jatyadi tape. We prefer jatyadi tape because jatyadi tape has one-ropan property. It is widely used in surgical procedure, after surgical procedure also. And we also use bala tape. And yesterday will be great for inserting pichu. And what is the proper mode of jatyadi tape? It has both vedana sthapan and ropan in nature, which is very important for wound healing. And in some ingredient like nimba, haridra, it controls the bacterial growth also and pushta immune property also. So that is the unipichu we are giving to the patient after prakshalan. Now, when you will prefer uniprakshalan and unipichu? If your patient has flat type of cervical erosion, then in spite of going to Agnikarm and Charkarm, you can treat that patient simply with uniprakshalan and jatyadi tail or balate unipichu. If cervical erosion is of simple or flat type, you don't have to do Agnikarm in that patient. You can achieve success only by simple unipichu and by uniprakshalan followed by unipichu. Unipichu we are doing for 8 or 10 days. You can just decide in the patient according to the involved area. And then comes the Erosion. We are doing Erosion also, and we use drugs like haridra, loth, yestimati, guruchi, tankan, fine powder of all these drugs in Erosion. We are doing here Erosion, many people do by many means Erosion, many things. Some people are using just paper poles for doing Erosion. Here we are doing Erosion by simple syringe, like 5 ml syringe. We just take fine powder of all this drug mentioned here, and we just remove the pistol from the needle and pistol from the syringe, and we just fill the powder in that syringe, and we just push the syringe just like we are giving injection to the patient, we just push the syringe and sprinkle all the powder over the eroded area with the help of Cusco's spectrum. It's very easy. And after or shown 1 hour, we are doing like wash also. Hello, hello, Dr. Vidya.
Yes, ma'am.
Am I audible properly?
Yes, ma'am. You're audible, ma'am.
Okay. So, Arjunan, we are doing with the help of syringe, and we just take fine powder of all these drugs. We just fill the syringe with this fine powder. You have to remove the needle and just push this powder on the with the help of Cusco. Just you should expose the cervix and push this powder. Sprinkle the powder over the eroded area, and just ask the patient to just rest for 1 or 2 hours. And after 2 hours, you should just wash. You should use uniprakshalan after Arjunan again. Never leave the patient after Arjunan as it is without uniprakshalan, because after 2 hours, if you are not doing uniprakshalan, it will lead to further infection, because the whole powder will be just stick to the cervix, and patient will come to you for to next day, and it will cause this further superadded infection. So after 2 hours of Arjunan, just wash the whole area of cervix properly with triple or Panchmal Kalpa. So after Arjunan, before and after Arjunan, you have to do Prakshalan, both before and after Arjunan, after 2 hours of Arjunan. Never leave the powder as it is on the cervical area, because it will just, you will not get proper benefit, and your patient might get another infection and discharge. Now coming to our main parasurgical procedure, Agnikan, what I was talking. Why Agnikan? Because we all know that Acharya Shishut has given preference to Agnikan over all the another parasurgical procedure. Charad Agnigariya, Kriyashu Vyakhyata, Roganam Apunarbhava, Vesar Shastra Chare, Ashadhyanam Tat Sadhya. Acharya has told that disease which cannot be treated with shastra, which cannot be treated with medicine, and which cannot be treated with shar, in that type of disease, we should prefer Agnikan. So, the Agnikan has three main procedures: Purvakar, Pradhan, and Paschatkan. And they are doing, you can do according to your days, either in evening and morning also. And yes, I just want to highlight the contraindication of Agnikan. I have told earlier that not in every patient you have to do Agnikan. If your patient has Pitta Pradhana Univyapar, she has burning sensation, and your patient is also a Pitta Pradhana Prakriti, and Kal is also Pittashkal, and so you can prefer Sharkan also in that type of patient. Okay? And we should avoid doing Agnikan during menstruation and during pregnancy. Now coming to the method, we all know we have to take consent, BP, and we have to wash, just empty the bladder, and all the equipment should be autoclaved. Very necessary. So if you are doing this procedure and not following just hygienic condition, then it will add to spread infection. The first main thing I just want to share. Many people are doing the type of Agnikan. We are doing here Agnikan in Bindu pattern, from outward to inward. Okay, in radial fashion. Okay, and we don't leave any area between the two duct area. Okay, if two bindus, we are not leaving any area, and we are doing in radial function pattern. I will show the video, then it will be clear. You can Dr. Vidya, is video is playing?
Ma'am, the video is not visible, ma'am.
There is some internet connectivity problem because slides are also. It is not playing.
Excuse me, ma'am.
Hello, Dr. Vidya?
Ma'am, any issues?
Yes, this video is not playing, Dr. Vidya. I have checked previously, it was playing, but this time it's not playing.
You can check it once again, ma'am.
Because I have it's local procedure, na? I have kept many videos. It was necessary to show how we are doing the procedure.
Yes, ma'am.
Just give us some minutes. Hello.
Yes, ma'am.
Dr. Vidya, video is not working here on this platform.
Yes, ma'am. It's not
So shall
working.
we continue with PPT?
Yes, ma'am. You can continue with your presentation.
My students are working. When it will be solved, we will show the video to our just.
Okay, ma'am.
What
You can
just suppose
continue your
instead of
presentation, ma'am.
picture to I just instead of picture to click on movie tool and play. Okay, I will just do. Yes. And click. I've done movie tool.
Ma'am, you can proceed with your presentation, ma'am.
Okay, just we'll just go with our presentation. Okay, so is slides are visible, huh, Dr. Vidya?
Yes, ma'am. The slides are visible.
So I was telling that we are just doing Omnicon with Pradhanikar. We just do here Omnicon with by two modes, one by Univarti and one by Swana Salaka. I will show you the Swana Salaka. And we do it in Bindu pattern. We just expose the cervix. You can just see we just expose the cervix with the help of Cusco, because if you are using Cusco, you can just do this procedure single-handed also. We expose the cervix with the help of Cusco, and we just heat the Swana Sharaka in the spirit lamp. And the main question is how much time you have to heat that Swana Sharaka. So the yeah, many theses have been done at our department. So we have seen that for Samyak Dal, what we are taking the kaput brand, the Yoshalaka should be heated up to 100 degrees centigrade. For that, we have seen that we just start while we are hitting the Shalaka with the spray lamp, we just start the counting from 1 to 50. And up to 50 counting, we are just hitting the Shalaka, and we just touch that heated salaka at the first at the outer periphery, okay, at the outer periphery of the eroded area, and just we tell one, and we just touch that heated salaka on that eroded area, and just we tell one, count one, and that we remove the uh, shalaka from that area, and we will see that it will give you a samyak kapodran appearance, and it will be samyak gat. Like if sometimes if you are hitting the shalaka first time, just count up to 50, and just burn for first time and look the color of the brand. If it is something like that, then you fix the your hitting of the shalaka up to that count. Suppose if you are counting up to 50 and you have done the burn first time that bindu, and if you are looking that it is atidat, then decrease the counting, count up to 40. And if it is not properly done, then you may increase your count up to, like if you're counted 50, then you can count 60. it depends how much your source of flame is giving heat to that salaka. So for the first spot will just tell you either your shalaka is heated properly or not. So start from outer periphery and just do it in radial manner and leave some space between two spots because it will help in healing. So and do it in radial fashion. And when you come at the point of the opening of the external os, very precautiously, you just also just burn the two corners of your cervical leaf. And after completing that, you after completing your after completing your Agnikan, just at the end you should do the with the help of dilate. You just dilate the cervix with the help of dilator because it will prevent the stenosis of the cervix. So when you finish your Agnikan, take one just small number of dilator and just insert in the external os and just make sure that os is open. And after completing the procedure, do univision with Jatya and ask the patient to keep it for 2 hours, or either she has to go for maturation. Just note down the first BP, shift to the patient, and keep the patient under just observation for any type of complications. Sometimes patient may complain, low abdominal pain, burning sensation. So you have to just manage the patient accordingly. And what precaution we ask the patient to avoid coitus and to avoid constipation during the time. And we prefer tissue of Jatya as we have told, it has very good run-rotam property. So we prefer Jatya uni tissue, which prescribe Jatya uni tissue for 1 week to the patient. And along with that, we prescribe some oral drugs. We will discuss later on what oral drugs we are giving in to that patient. And we just check the for the cervix healing after 1 month. We do PS. In between, we never do again and again PS examination because it may cause some superadded infection. So better to examine your patient after 1 month, either it is healed or not, and what is the condition of your site. There is also one video I have made. It is the Anglikam done by the university. Why Swan Salaka is preferred over university? Because when you will do Anglikam with university, the whole area will be covered with smokes and fumes, and it will blur your sight. So we prefer here Swan Salaka over university in doing, and also Swan has itself has good run-open property. Look, you can see this the eroded area, and this Agnikan has been done, and after Agnikan, the Samyak appearance. So, what will be the probable mode of action of Agnikan? We all know that by Yushni Tikshindu, it proposed the action of Anshuran and Vahan of Vikrupa, and it also has strong property. So the Ashukari property of Agni, it promotes rapid healing of vrana and it purifies the local tissue. So it do the local shodhan of that vrana. And I told that about the Swana Shalak because Swan itself specifies all the dosha, 3 dosha, having 3 dosha property. And if there is any infective pathology, it is screening her, Varhar, and Vishnuhar. And one neuron of Swan is also responsible for bringing back the normal appearance of eroded surface. Dr. Vidya,
Yes, ma'am.
slides are visible.
Yes, ma'am. The slides are visible.
And what the therapeutic heat burn does, it affects the extent of damage of tissue burn, the temperature, what we the tissue, tissues are exposed, and the energy carried by positive agent, and the smell of exposure. I've already told that the temperature, which is responsible for some inflammation, it is up to 105 to 125 degrees Celsius. And in modern terminology, we all know that burn triggers the coagulative pathology. So the therapeutic heat burn, it reduces inflammation, decreases swelling, and improves the collagen production for tissue repair. And it also increases the blood flow. So all these are benefits of Agni Karma. And when you will prefer Agni burn, I told then when there will be capillary type of cervical erosion, there will be hyperplasia and there will be capillary-like structure in erosion. Then you will prefer in that type of cervical erosion, you will prefer Agni burn. We have even treated mild dysplasias in one case also there with Agni burn. So in that type of capillary type of erosion, we will get very good result with Agni burn. Again, coming to the charaka, we are using Pitta and Kashish char for this charaka. And we are doing obviously after completion of lenses. These are the particular instruments and what you will need for charaka. Before doing any type of either Agnicam or any type of local procedure, please go to ES and PD examination. You should expose the cervix and you should properly do the ESPD examination. Dr. Vidya, slides are moving.
Ma'am, the slides are not moving, ma'am.
Slides are not moving. Now it's fine.
Yeah, ma'am. Now it's fine.
Okay. So I was talking about the pradhana karma of Shara Prakriya. So you ask the patient to lie down in dichotomy position. You should clean all the private parts with antiseptic solution. Expose the cervix with cuspo speculum. It will just give you the single-handed approach. And the affected part of the area should be cleaned and not with the help of wash paste. And the char is applied with the help of cotton swab on that whole area with the help of a sponge holding process. And after applying char, just leave that char till count of 100, either for 5 minutes or simply you can count up to 100 and after that count you may get a samyak reflection. After counting 100, you have to remove that applied char, wash that area with we are using lime water also. Sometimes we wash that area with butter also. And even you can prefer trifla cloth also for washing that applied char. And when you will wash that applied char, you will just look very good blackish cushion white color of samyak. But here also, after completing the procedure, you have to just record all the vitals of the patient and just you have to keep patient up to 2 hours under your observation. Here you can see the chart. You can see service applied. After applying char, your procedure is completed. After washing the char, applied char, you have to insert tissue with jatari oil. Here we prefer Kashishadi char for Sharakan, and also you can use Apamak char also because Apamak char and Kashishadi both have very good result. And what will be the mode of action? Like we all know that Kashi says Katura Shishri and Vishugun, and we do like Sut has Amras and Lagugun, we do Shodan and Tempat has Rupan property. And we all know that Char itself has Shodan, Rupan, Lekhan and Rupan property. So it will all lead to the correction of the. And I just want to share some of the good cases with you. You can see. Look, I will just show you. You are, if you will just focus on the case number 2, you can see and you can diagnose that this type of cervical erosion is of papillary type. Okay, you can see small papilla in the eroded area. Okay, and this is the follicular type, and this is the flat type. So these two are the successful cases we have treated with Agnikam and Sthani chikitsa and tissue. There are many research works done at our institute, like many PhD and PhD works has been done. Agnikam, especially with Swarna Shalaka. And this year, one of our MDs has just opted for Tamra Shalaka for. We will look what Tamra Shalaka, how it gives result, either better than Agnikam or equal to the Agnikam, or just Swarna Shalaka is best for. One of the PhD work I just want to share with you is of Dr. Ashia under the valuable guidance of Professor Erosion. It was completed last year. We just want to look either unical Dharan or unipichu is better or Agnikam is better. So we have given 2 mode of groups in this case. One with Agnikam and oral Khadirastak one. And in other group, we have given unipichu with Tumrical and Khadirastak one. And we have seen that in group A, that is in group of Agnikam and Khadirastak, you can see we have got very good result in each and every associated complaint and giving of cervical erosion also, like Unishra, Unida, tissue. After 15 days also, and after 16 days, 87% of patients were completely cured in group A, that is Agnikam and Khadirastak. So I have told already that if your erosion is of severe type and of worst area, we should prefer Agnikam over other procedures. What internal medications they are giving here after Agnikam? We especially choose one Shodan Rupan and Shodan properties like Khadirastak. There's very good result after Rupan procedure. It contains Kadir, Triplan, Patol, and it has pushed and produced property, and also give Tripla Guglu, we give we give Rasayan Chok, one bus, and Haridra combination also. So after doing Agnikam or Charkal, advise your patient 8 days unipichu along with this internal medication, and just follow up your patient for any type of complaint like pain, and do PS examination after 1 month. Okay, I have told that never do PS examination again and again in curiosity, like what has done to you, because that eroded area, it takes 1 month to heal properly and to come in normal color, the vagina, cervical mucus. So after 1 month, you can just look out for heal cervical erosion. So this thing we are doing here in cervical erosion cases, and we have treated many erosion cases successfully. Thank you. And sorry, I could not show you the video. I have put a Charkam and Agnikam video. I will just try one last time for our listeners if you can be open. Dr. Vidya?
Yes, ma'am.
You can ask your
Yeah,
listeners
ma'am.
for
Sure,
any
ma'am.
question. Meanwhile, I will just, if any query, I will just
Yes, ma'am. Thank you,
it
ma'am, for
just
taking your time for preparing us such an extraordinary, wonderful presentation. We will now go ahead to the question and answer session. Delegates, please post your questions in the chat box. Delegates, you can post your questions in the chat box. Ma'am, we have a question.
yes, Dr. Vidya.
How to do avachuranam?
Yes, how to do a shonen. I have told that just you have to just expose the patient like with cusco speculum like this you are showing in this picture in the position. Take 5 ml syringe. Okay, simple 5 ml syringe. Remove the needle. Okay, and take powder of haridra, guduchi, khadir, dodr, and tankan. We also add here, and all this drug will be fine powder. Okay, and mix the powder, all these powders. Just fill that syringe with this powder. Okay, we remove that piston from the syringe, fill the syringe from behind of the fill the powder in the syringe from behind of the syringe, and then apply the piston. And you have to push like you are giving short of injection to the patient, just like you have to push the piston, and your powder will be just it will sprinkle all over the area, exposed area of cervix. So it's very easy procedure. You can do at OPD level, and it gives us ease when we are doing with syringe. Because some people use cotton swab, some people use gauze piece to apply that fine powder. But many when we are doing with gauze piece, many of most of our drugs are remain in the gauze piece. It not completely stick to the eroded area. So it's better to use syringe and just sprinkle the powder. Push the syringe, it will just beautifully just spray all the powder over the eroded area. Very easy procedure. And I
Thank
have
you,
told
ma'am.
after doing Aushunan, you must have to wash that sprinkled powder after 2 hours. Just do uniprakshan and after 2 hours of Aushunan.
Thank you, ma'am. Ma'am, we have another question. Neem Quat Prakshalna, is it good instead of Triphala?
Sorry?
Neem
Nimquat?
Quat Prakshalana,
Yeah.
is it good instead of Triphala?
Yes, you may prefer Nimquat. You can both have same action because it is three-dosha property. So we use, but you can instead of that you can use Nimbo also. And I have told in Trifla Quat many times, most of the time we add Nimba, Haridra and Spati or Tankard. We add that in Trifla. But you can simply use Nimba Quat Prakshana also. It will do. Okay.
Thank you, ma'am. Delegates, you can post your questions in the chat box. Ma'am, we'll wait for a couple of minutes. Delegates, you can post your questions in the chat box. Ma'am,
Yeah.
we have a question.
Yes. Yes.
Treatment in CIN cases.
Yes. Dr. Vidya, I have told during my presentation that CIN one case in mild dysplasia, you can very successfully treat with Agnikarm and this local procedure, especially with Agnikarm. It's one shalaka. Okay. And when it is moderate type, like spring 2, then this local therapy never works. Okay, we have seen here. It will give you very good result in sin 1 case, but moderate and severe sin, I just up to my knowledge, what we are doing here. If anyone is getting very good result in grade 2 and grade 3 with this local therapy, then it's good. Let me share at this platform also. But we are treating here sin 1 up to sin 1 very successfully with this Agnikar chikitsa and with this Khadirastapwa, Khadiradighanmati and Punanpadi. We are getting very good result in sin 1.
Thank you, ma'am. Ma'am, we have another question. Yoni Shalana and Yoni Pichu, duration for how many days? The duration of Yoni Shalana and Yoni
Yes,
Pichu, ma'am.
Yoni Prakshalan and Yoni Pichu. We are just in one cycle, we are advising to the patient for 8 to 10 days after cessation of them. And if it is simple and flat type of erosion, it will be completely cured within 3 days. And I have already told that in flat type, we prefer Yoni Pichu. Because with simple Yoni Pichu for 8 to 10 days, your erosion will be cured.
Okay, thank you, ma'am. The next question. After Avachurnam, can the patient use seed bath instead of Yoni Prakshalana?
No, Dr. Vidya. I don't know whose question is this. Because I have told, when you are using switch bath, okay, what switch bath is doing, your whole perineal area will be dipped in that water, but that water will not go inside the vagina to the cervix. And your sprinkled powder is just adhere to the eroded area on the cervix. So stitch bath will not remove that eroded, that sprinkled powder or chilled powder. Okay. Yes. First you do prakshalana after 2 hours of Ochunan. First you do prakshalana, remove that powder from that eroded area. And after that at home you can advise stitch bath at added procedure. You can. But you have to, by prakshalana you have to remove that Ochunan powder. It's mandatory. Switch bath cannot remove that powder from inside of the vagina, orchonate powder. So you cannot leave that orchonate powder overnight as it is. Okay?
Okay, ma'am. Ma'am, the
Yes,
next
after
question.
doing prakshalan, if you remove that orchonate powder, and you can advise your patient, if you wish, you can advise your patient switch bath. But you have to do prakshalan mandatory.
Okay, ma'am. Can we move to the next question? Ma'am, curdy discharge from vagina with itching and foul smell. The treatment for this, ma'am.
Look, curdy discharge, if discharge is infective and patient has itching or burning sensation, like if she is giving appearance of surgery like this, first you have to treat that infection, then do local procedure. Okay, if discharge is infective. And for treating that curdy white discharge, where you can use Chandraprabhavati, we can use Rashayan Guruji, Chokji, Varumbas combination. There are many formulation available in market. But first treat that infection, then advise your patient either Pichu, either Agnikarm afterwards. Never do advise your patient Unipichu or Agnikarm in infective discharge or acute cervicitis. Okay, if there is thin discharge, non-infective discharge along with erosion, then you can treat that with this local procedures, sthanic chikitsa. But if there is infection, purulent discharge, offensive smell is there, first treat that infection. You can treat that infection by sich bath, by yoni prakshalan, by giving oral internal medication. And when the infection subsides, then just you can do sthanic chikitsa for erosion.
Ma'am, moving to the next question. Is the treatment differs in thin and thick vaginal discharge? If, what will be the treatment for both?
Sorry, Dr. Vidya, pardon please.
Ma'am, is the treatment differs in thin and thick vaginal discharge? If, what is the treatment for
Okay,
both?
ma'am, is I am just looking in the chat box. Is the treatment differs in thin and thick vaginal discharge? Then what will be the treatment forward? Yes, I have just talked about this meanwhile in between my presentation also. Like, look, first in discharge, we add one prakshalan. If there is thin watery discharge, use punctual cloth for prakshalan. And if there is thick discharge, there is pushed cuff is there, discharge is thick, then you should prefer ning or tripla along with haridra, and we add tankad because you want to remove that dust cuff from there. And if your discharge is thin, non-infective, then we want to do a stammer. Then there we use panchmalkal cloth. Locally also sometimes we give for oral medication, oral administration of panchmalkal cloth in same type of discharge. And Chanprabhavati you can use in both type of thin and thick discharge. Along with that, there are many formulation like shiny combination, what I have to these things, but local procedure is made. So that's why I am telling yoni prakshalan in thin discharge, you have to do it. Summer, and when there is thick and infected discharge, you have to give cough nisarak property like tankan. You have to use tripla in spite of panchval.
Ma'am, moving to the next question. Do any complication occur if
Yes.
avachurna is left for a long time?
Yes, I have told that there will be infection, there will be foul smell, and you will give further more infection and problem, another many problems to the patient. And sometimes, many times, patients feel discomfortable also.
Ma'am, can we move to the next question?
Yes.
Can we use Tiktata Grida Pichu? Is there any difference in effect using Taila Pichu and Grida Pichu?
Okay, most of the time we prefer tal pichu. Why? Because tal has Ushnagum and Shodhan and Ropan property, especially tal. Okay, Pit also has Ropan property. Sorry, Grit also has Ropan property, but Shodhan property, tal has better Shodhan property than Grit. So here we most of the time we prefer tal pichu. But simply if you want to open, if there is not no any type of chronic infection, is there simple flat type of erosion, then you can prefer grit also. But if you want to do Shodhan and Ropan both, then you should prefer tel. If you only want to do Ropan, then you should prefer grit tissue also. You can prefer grit tissue.
Ma'am, the next question. For senile vaginitis treatment, which Grida is useful?
Try grit. Here also you have to use tel. You simply use Balatal Pichu. It's very good in senile vaginitis. It will give wonderful results. Simply Balatal Pichu.
Ma'am, moving to the next question. Will there be addition of the burn sites together after Agni Karma? If yes, can we please gauze?
No. Don't never place anything like gauze. Look, there will be no any type of infection adhesion at one side. Okay. I have told when you are burning the area, you will burn in radial fashion. Okay. And at between the two burn spots, you will leave some space. You will leave some tissue between the two burn spots. Okay. So this if you are leaving some space, it will just fasten the healing procedure. Okay. And adhesion, we all know that our body has a complicated mechanism of wound healing, any type of wound healing. Oh, but only by Agnikar, what we are doing, we are just removing that unhealthy tissue. And the rope and the wound healing is itself done by our body mechanism, defense mechanism. Okay. And yes, we have to be precautious that if you are just touching that corners of the cervical, you should make sure that you are not doing any type of cervical stenosis. That's why I have told that when you have finished your Agnika, take one dilator and just insert inside the external os. So it will prevent any type of adhesion at the external os and stenosis of the cervix.
Ma'am, we have another question. Treatment of spotting PV after D and C by not stopping the hormonal pills.
Treatment of spotting PV after DNC, not spotting. Okay, if you okay, I will just answer these questions beyond the topic. If you have done DNC in any patient and your patient comes with complaint that I have spotting PV, so you have to be very vigilant. There are two things: either in DNC, while doing DNC, if you are removing a retained product, if there are many probabilities that you have left something, you have not properly curated that retained product. Okay, the properly the curettage procedure is not done properly, so that left out retained product will cause spotting bleeding for many times, for many long time. So, and if you want, if this is the case, so that is why after DNC we just after 7 days or 8 days we just do one simple sonography and look that properly evacuated or if, because if you let something, patient will have complaint for spotting for 1 or 2 months. If that thing is not excreted or evacuated from uterus, so in that case, if there is some retained product left out, please don't give any type of samban chikitsa. Because if something is left out after DNC, you should give some what we call it medical curettage type of drug, like Garbhashaya Shodhak drug, like Dashmulakvaka, Devadar Vyadikvaka. This type of medicine you should prefer. Arvardhani, Tripla, or Parangi, or Tangan combination. Okay, and if you have gone through sonography and nothing is left out, then you can use Samban chikitsa in that of patient, Raktastapa chikitsa in that type of patient. There are many drugs like Goshiradi Google we prefer a drug like Vasha Khadir Ludra combination. Yes, she has written, ma'am, USG is normal in this case. After 2 months of DNC, there is spotting. So, dear, you just use like Raktasthapak chikitsa. Many patent drugs are also there, like you may prefer Iapon or Raktastambak tablet. And if you want to go in traditional preparation, Lodrasan and Patrangash, so 20 ml, 20 ml, we can use it. It will give very good result in this type of case. Lodrasa and Patranga, so you can use in this type of case. Dr. Purnima has asked adenomyosis treatment after menopause. Okay, Dr. Purnima, adenomyosis after menopause, adenomyosis is rare. I have seen in very few cases, but it's not that you cannot treat. You have to treat adenomyosis in that patient same we treat in reproductive age patients. Like in adenomyosis, especially we are using Devdar Vyadikor. It gives very good result. And Bukshuradi Guglu is also giving very good result. Shilajit tablet, a very good result in adenomyosis. And endotone capsules of Sharat Pharma, it's also give very good result in adenomyosis. And if you want to go in classical preparation, you can use Kadir Muslikwar in adenomyosis. Will also give very good result, excellent result. There are very broad range of medicine what to use in adenomyosis. You have to assess the prakriti, you have to assess the condition of your patient. Sometimes patient only come with adenomyosis diagnosed in investment. Sometimes patient comes with to you with severe bleeding. When she comes to you with severe bleeding, first you have to do Raktasthapan chikitsa. Then after you have to use Lekhan and Shodhan. You have to do Lekhan and Shodhan chikitsa to treat that adenomyosis.
Thank you, ma'am. Delegates, you can post your questions in the chat box. Ma'am, seems there are no more questions. Shall we end the session?
I'm sorry, I cannot show the video here at this platform. I will just send this PPT to you people at your DIKSHA mail. You can share
Okay.
with your listeners because it is opening in my PC, but that video is not opening in this presentation at this Zoom platform. And it's successfully opening in my laptop also and in my PC also. We have checked 2 and 3 times. So it might be there might some problem. I am unable, either I am not working properly at this platform. You can share the PPT with your listeners and they can see the procedure of legal
Okay. Thank you, ma'am. Now, I request Dr. Devi Isnair, ma'am, Associate Professor, Department of Roga Nidana, to deliver the vote of thanks.
Good evening, ma'am. We are really lucky to have you, ma'am. Ma'am, Dr. Sipika actually representing India's department. Really lucky, ma'am. Today, the topic she explained is common cases we are getting Garbhashaya, mukhagata, vrana, and its treatment. So, ma'am has explained each and every aspect, and the like really we want to thank for one thing, you patiently heard each and every doubts of the delegates and you answered it. Ma'am, really we are thankful your explanation for your clinical experiences, everything. Thank you so much, ma'am, and I thank all the delegates who patiently attended the session.
Thank you, ma'am. Victory is always possible for the person who refuses to stop fighting. Losers quit when they are tired, and winners quit when they have won. To know more about our updates, please do stay connected with our social platform. That's all for today's most interesting session with a lot of new information for us to close our eyes with thought provoking knowledge. Thank you all for joining us. Thank you.